love it if you walked into your client's room and your client looked at you and said, oh my goodness, I am experiencing early signs of hypovolemic shock. Okay.
Yes, they know it already.
I am going into shock. Your client is not going to say that.
Right.
They're not going to say those words. So you're going to have to figure out, is there anything going on with them? So that's great. You can name all those signs and symptoms, but when we put it in a scenario, can you pull it together and identify what that problem is?
Nursing Navigator's here. Wipe away those study tears. Review's got your back. Listen close. Stay on track.
Okay, Annette, I've got a really big question, and I know students have asked you this a million times. And I know that there's somebody out there that wants to ask this too. Why are the tests the way they are?
Oh.
Why is the testing so hard?
Okay, so when we are creating tests, we know students are really smart.
Yeah.
We know they're studying. We know that they're reading their textbook. We know that they can say word for word that clinical alert that's on page 897 in the right lower quadrant of that page. We know that they know exactly what it says word for word. And that's easy.
Yeah.
I mean, it is hard to memorize some things, but it's easy to kind of regurgitate those facts. But we want to see, okay, all right, you know all that information.
Mm-hmm.
So now let's kind of shift gears a little bit and shift your focus to when you're in a situation with a test, how are you going to respond?
Yeah.
So there's a lot that goes into creating a test. And we have to make sure that it is a valid question.
Mm-hmm.
Are we matching up the question to the content that was taught?
Right.
Are we asking questions that are making them critically think?
Yeah, they don't like that.
I know, they don't like that at all. And are they going to use good clinical judgment?
Mm-hmm.
Is it a relevant question? Does it match up with what you said you were going to teach with your objectives?
Right.
So we have to look at the validity of it.
Yeah.
And does it match up with NCLEX?
Mm.
So we have to follow those guidelines too. Is it a reliable question? We have all of these statistics, and students don't really understand that, but we have statistics we have to look at.
Yeah.
When we generate a test, when we give a test, we have to look at the statistics. We have to look at the reliability of the test, the validity of the test, the item difficulty of the test. Is it a hard question? Is it a really easy question? Is it keeping that same difficulty?
Yeah.
Is the item discriminating? And what I mean by, and I know what discrimination is a harsh word to use, but we have to look at a question discrimination, meaning, do your students who perform well, are they consistently getting those questions correct?
Right.
Or the students who aren't doing as well, do they consistently get it wrong? So it doesn't discriminate and show that, you know, your stronger students are consistently getting it right, and your lower performing students are consistently getting that wrong. And we have to look at the distractors. Every single option that we give, is it plausible? Is it realistic? Because if I put a student in a situation and there's an option there that's not even relevant, you know, they're going to go, oh,
not that.
Yeah. Not that one for sure.
Yeah.
And I love the episode that Martha did where she was talking about looking at questions and looking at distractors.
Mm-hmm.
And do I put it in my back pocket? Do I hold on to it? Or do I immediately mark it out?
Right.
So we have to blueprint our test.
Yeah.
So what does a blueprint mean? Well, we have to match up to the is it a question that's asking about knowledge? Is it asking an application type question? Is it having just the student understand something? Is it matching it with NCLEX? Where does it fall in their nursing process?
Oh my gosh. I don't even think that I thought about all of these things for sure when I was a student, but when you become a nursing educator and there are all of these things that have to be in place just to create a test.
Yes.
I don't think students really think about the fact that it was a process.
Right.
Like we didn't just go grab the questions out of the back of the textbook and slap them, on the test. Is that we had to get together and look at this and determine all of these things and figure out, is this going to work?
Right.
And so I also think it's important to note that I think a lot of schools make sure that those tests have been vetted after a point. Like, it's been given enough times and it's been looked over enough times and we've thrown out enough questions over time.
Yes,
you
we
know.
do throw out questions.
Yes. That you're going to get some of those points back if we end up throwing out questions. But that we've looked over this so many times.
Right.
That this is a valid test, that this is a good test.
Right.
And so, students out there, like, this is the process. And so I think a really good point when it comes to the test is I know I had an instructor once that kept telling students is that our main goal, our ultimate goal, is to make sure that you're safe.
Right.
And then our second goal is to make sure that you can pass the NCLEX. And that's when we give those tests that we're not just trying to meet a goal. We're trying to, help you pass the test too.
Right. So students have a hard time with testing.
Yeah.
Because we're transforming them into this knowledge that they know to now apply it to a situation. So students very commonly ask the question, how do I study for my test?
Yeah.
How do I prepare? And so we try to do that in the classroom setting by role playing. I laugh and joke with my students because I tell them, wouldn't you love it if you walked into your client's room and your client looked at you and said, oh my goodness, I am experiencing early signs of hypovolemic shock. Okay?
Yes, they know it already.
I am going into shock and it's early and I want you to recognize this now. I said, your client is not going to say that.
Right.
They're not going to say those words. So you're going to have to figure out, is there anything going on with them? So that's great. You can name all those signs and symptoms, but when we put it in a scenario, can you pull it together and identify what that problem is?
Yep, because that's kind of like the NCLEX, right?
It is. It really is.
Where they don't tell you that all the time. They might say, the client's blood pressure is this, and the pulse is this, and what other things about them, other signs and symptoms, and you have to put that together to figure out what the problem is.
Right.
Yep, that's really good. All right, so we kind of now understand why the tests are the way they are. Why is everything else structured the way that it is, like clinical or SIM, like SIM lab? Why is that the way that it is?
So when our course is set with a certain number of hours, credit hours that the students are going to get, then that correlates to how many clinical hours they're going to have, how many classroom hours they're going to have, how many clinical hours they're going to have, and how many lab hours they're going to have. Yeah. So then we are in charge of setting all of that up. Yeah. And so we have a certain number of hours that we have to meet in that course. And then it can depend on, does the clinical have any sites available?
So good.
I mean, really, there are areas where there are very limited clinical spots.
Right.
Students may ask, why can't we go to clinical where I live? Because they may commute an hour to school. And they're like, hey, it'd be closer if I could do my clinical where I live. Well, clinical sites are based on where the college is located and do they have that jurisdiction and do they have the agreement of affiliation for them to do clinical spaces there? Do they already have schools that are there? What floors are available? So there's a lot of pieces in that puzzle that we have to manipulate to get it to work and provide the best experience that we can for our students.
That's right. Because again, I think that a really good point to make here is we're going back to that accreditation piece, right? And now bringing in the legality of everything.
Right.
And, what if those clinical sites are already taken by other schools?
Right.
In certain states, there are so many nursing schools and only so many clinical sites.
That's right.
Right? And so we're all kind of fighting a little bit like, who's going to get first dibs on blank, 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 And I think it's a good thing to have those things about jurisdiction in place so that way everybody kind of gets a fair shot at going to clinical. And sometimes it's just unfair.
Sometimes it is very unfair.
I know.
And then I get, I want to fight for my students, but I understand it. And then we have limitations on the number of students we can take into clinical. So we are only allowed X number of students per one faculty member.
That's right.
So students may be like, hey, why can't 3 or 4 of us go over here? Well, then from a financial standpoint, from the school, they don't want to use up one faculty member for 3 or 4 students.
That's right.
It's hard to justify that.
That's right. And in most situations, I know there is some flexibility with this, but in most situations, your clinical experiences have to be monitored and regulated by a faculty member.
That's right.
And so, like there goes that too, is that, that's why you don't go to clinical by yourself. And in some of those special situations where we might visit a clinic or we might visit this specialty area, then we may send one student and have an agreement with that area where they'll monitor that student.
Yes.
But that faculty member is usually checking in, or they might be in the same facility as them and can come quickly check on them. But I think we have to, keep that in mind too, is that we have to be there.
We do.
That is good because, they always, they're going to ask those questions. And that's what we're trying to do today is we're answering some of those questions that you may have. And I think we have to also remember we don't want to just meet standards, right? Like we just don't want to meet a standard and meet a goal. There's an ultimate goal beyond all of this.
Right.
Is that I'm teaching you for the day that you take care of me or the day you take care of my mama, We want you to keep somebody's grandma safe.
I tell the students all the time, I'm like, okay, imagine that who are the type of nurse that you want to be taking care of you. If you're laying in that bed, what kind of nurse do you want coming in there and taking care of you? Do you want you?
Yeah.
Would you want someone like you that's thinking like you and coming in there and assessing the way you assess or following those safety protocols in your med administration?
Yeah.
Do you want that nurse?
Oh, and sometimes you have to go sit with that, don't you? Because I'm like, no, I don't want me. No, I want somebody who knows something, but at the end of the day, yes, I want someone who's willing to learn, right?
Yeah.
Someone who's willing to ask the right questions and somebody who wants to care.
Right.
So if you got that, you're on the right track.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.